Assalamualaikum and hi. My name is Nur Ain Amira Zulaika binti Ilham. My matrix number is 1044.
My name is Dana Natasha binti Zulkarnain. My matric number is 1071.
My name is Putri Nur Irma Amira binti Amiral. My matric number is 1059.
My name is Nur Eli Sofia binti Muhammad Badrin. My matric number is 10x6.
Today we are going to present an article entitled Charts That Make the Case for Public Health. The article uses a series of charts and statistical data to explain the importance of public health and how it affects people's health, life expectancy, and government spending. It also highlights the challenges faced by the public health sector and why continuous investment is necessary. The purpose of this presentation is to explain the key findings from the charts, identify the trends shown in the data, and understand how public health influences health outcomes and healthcare policies.
So I'll be explaining about this graph right here. This graph is a horizontal bar chart. The title of the graph is Age Standardized Death per 100,000 people. The y-axis is peer nations/countries, and as for x-axis, it is number of deaths. This graph doesn't have legends, so
this graph shows considerable variation in death rates among the countries. Japan has the lowest age standardized death rate with 273 deaths per 100,000 people, suggesting better overall health outcomes and longer life expectancy. Japan's lower mortality rate is often linked to a healthy diet, active lifestyle, and an effective healthcare system. On the other hand, Denmark records the highest death rate at 440 deaths per 100,000 people, followed by United States with 418 deaths per 100,000 people. The United States stands out because despite its high healthcare spending, it has a relatively high mortality rate, which may be influenced by factors such as obesity, chronic diseases, smoking, alcohol use, and unequal access to healthcare. The age standardized death rate gradually increases from Japan, 273 deaths, to the United States, 418 deaths, before reaching the highest rate in Denmark, 440 deaths per 100,000 people. Most countries have death rates between 330 and 400 deaths per 100,000 people, showing a steady rise rather than a sudden increase. Although there are slightly larger differences between some countries, such as Japan and Switzerland, the overall pattern is a gradual increase across the ranked countries.
So for the data analysis for this graph is the US has substantially worse health outcomes than all its peer nations. By way of example, this graph shows non-communicable disease mortality in 17 high-income countries. The US has the second highest death rate at 418 deaths per 100,000 people, more than 50% greater than that of Japan.
This is a line graph. This graph compares the ranking of mortality death rates for males, solid line, and females, dotted line, across different age groups. The x-axis represents age groups, while the y-axis represents the rank, where rank 1 indicates the highest mortality rate and rank 17 indicates the lowest mortality rate. This graph shows that mortality rankings remain consistently low, rank 17, for both males and females from birth 0 to 1 years until around 40 to 44 years of age. This indicates that mortality is relatively low during childhood and early adulthood for both sexes. From 45 to 49 years onward, the ranking begins to improve gradually, indicating that mortality becomes more significant as people age. The increase is initially gradual, with only small changes in rank between the age group of 45 to 74 years. After the age of 75 years, there is a rapid improvement in ranking, moving from rank 15 towards rank 1, especially for males. Male mortality rises more sharply than female mortality, suggesting that men experience a greater increase in death rates at older ages. Between 80 to 89, the gap between males and females becomes more noticeable. Males reach rank 3 by the 85 to 89 age group, while females are at rank 5, indicating that male mortality is higher than female mortality during this period. In the oldest age group, which is 95 to 99 years, both males and females reach rank 2, showing that the mortality is at its highest level for both sexes in very old age. Overall, the graph demonstrates the mortality remains by low during early life but increases with age.
So for the data analysis for this graph is, although they have higher mortality rates overall than their peer countries, their ranking on health indicators is not distributed evenly across the life course. So this graph right here shows that while they have the worst mortality outcomes among their peer set throughout most of the life course, at the very end of the life course, they actually move to the very best.
The title of the chart is Percentage of Social Care and Healthcare from a Global Perspective. It is a vertical subdividend bar chart. The x-axis represents the countries, while the y-axis represents the percentage of spending. The legend consists of social care and healthcare. Overall, the chart shows a gradual decrease in total social care and healthcare spending across the country. This chart compares between healthcare and social care spending across several developed countries. It shows that the United States spend much more on healthcare, which is 16%, but less on social care, which is only 9%. When both types of spending are combined, the total spending of the United States is similar to other developed nations. So the article explained that investing in social care, such as education, early childhood care, and environment, also public health, is important for improving people's overall health. Therefore, a better balance between healthcare and social care spending can lead to better health outcomes. Next chart title is Life Expectancy for Males at age of 50. It is a vertical bar chart. The x-axis represents the income, where quintile 5 represents the highest income group, while quintile 1 represents the lowest income group. The y-axis represents life expectancy in years. The legend shows two cohorts, which is 1930 cohort and 1960 cohort. Overall, the chart shows a gradual increase in life expectancy as income increase. This chart explains the impact of rapid changes in social condition on mortality rate. While mortality rates have declined in most countries since 1990, they have increased among middle age. One of the main reasons is the rise in unintentional drug overdoses, which is largely linked to the overprescription of pain medication. As we can see, quintile 5 represents the highest income group and has the highest life expectancy, which is 38.8 years. In contrast, quintile 1 represents the lowest income group and has the lowest life expectancy, which is 26.1 years. This shows that people with higher income tend to have longer life expectancy.
Before discussing the findings, let me first describe this graph. This is a line graph titled Mortality Rates Among Middle-Aged Adults in the United States and Per Countries. The x-axis represents the years ranging from 1990 to 2012. The y-axis shows the mortality rate measured as the number of deaths per 100,000 population. Each color line represents a different country. These include the United States, France, Germany, the United Kingdom, Canada, Australia, and Sweden. The purpose of this graph is to compare how mortality rates among middle-aged adults change over time across these developed countries. As we can see, almost all countries including France, Germany, the United Kingdom, Canada, Australia, and Sweden experience a steady decline in mortality rates over time. This indicates continuous improvement in healthcare, living conditions, and disease prevention. However, the United States shows a very different trend. The red line representing white non-Hispanic America remains high and even increased after the late 1990s, while other countries continue to improve. One of the main reasons for this increase is the epidemic of non-attention drug overdose, particularly involving prescriptions painkiller due to the widespread over-prescribing of these medications. Drug overdose deaths increased dramatically. In fact, the drug overdose mortality rate in the US tripled between 1990 and 2006, and this rise was largely concentrated among middle-aged white non-Hispanic Americans. Overall, this figure highlights how rapid social change and public health issues, especially the crisis, have negatively affected mortality trends in the United States, making it an exception compared to other developed countries. Before explaining the findings, let me first describe this graph. This is a line graph that compares motor vehicle death rate and vehicle mistravel in the United States from 1925 to 1995. The x-axis represents the year from 1925 to 1995. There are two y-axis. The left y-axis shows the number of deaths per million vehicle miles traveled, while the right y-axis shows the total vehicle miles traveled measured in billions. The purple line represents the motor vehicle death rate, and the green dot line represents the vehicle miles traveled. The purpose of this graph is to compare change in road traffic deaths with the increase in driving over time. Looking at the graph, we can see two opposite trends. The green dot line show that the number of vehicle miles traveled increased steadily from 1925 to 1995. This means that more people were driving and the total distance traveled on the roads kept increasing. However, the purple line showed that the motor vehicle death rate decreased dramatically from around 18 deaths per million vehicle miles in 1925 to about 2 deaths per million vehicle miles by 1995. This is considered one of the greatest achievements in public health. The decline did not happen because drivers suddenly become better. Instead, it was the result of improvement in the conditions surrounding driving. This improvement includes safer vehicle design, better road infrastructure, seat belts, airbags, and laws that reduce drunk driving. Overall, this graph demonstrates that public health intervention can save lives by changing the environment and policies rather than relying only on individual behavior. It highlights the importance of creating safer conditions to reduce injuries and deaths.
The title graph is proportion of NHI-funded projects that included the terms population of public India titles for year 2004 until 2014. This graph is a line graph, and for the y-axis is percent of total funding. The x-axis is fiscal years, and for legend is no legends. For data analysis, the graph shows a fluctuating trend from 2004 to 2014. The percentage increased slightly from 2004 until 2006. Meanwhile, the graph decreased in 2007 and 2008. It rose sharply in 2009 before dropping again 2010 onwards. Overall, the percentage showed a downward trend and reached its lowest level by 2014. For the next graph is, the title of graph is proportion of global population by age. This graph shown a line graph. Y-axis show a percentage of the total world population and x-axis is year. Data analysis for this graph is, there was a decrease in red line shows the proportion of population children under 5 years. Meanwhile, the blue line shows the proportion of population aged 60 years and above are increased. These two lines intersect in 2020. At 2050, the proportion of population aged 60 years and above becoming a larger group compared to children aged below 5.
To conclude, public health achieved lasting improvement by creating healthier environment and focusing on prevention rather than treatment. By implementing effective policies, improving healthcare system, promoting health educations, and creating safer communities, we can reduce disease and improve overall well-being. The key lesson is that prevention is always better than cure. When we invest in healthier environment on preventive measure, we not only save life but also improve people's quality of life. That's all from us. Thank you.